Hello, and welcome to Candid Conversations with Dr. Kelsey. I'm your host, Dr. Kelsey, and this is the space where I share my honest thoughts, real experiences, and the no BS conversations I wish more people were having about movement, training, injury recovery, and life as an active human. The goal of this podcast is to help you better understand your body, think more critically about rehab and fitness, and feel more confident making decisions so you can stay active long term. Before we start, a quick reminder. I am a physical therapist, but I am not your physical therapist. Nothing here is medical advice. So if you're dealing with something specific, please reach out to your PT or schedule a session to work with me. All right, now let's get into today's conversation. So today I wanted to talk about expensive recovery treatments. And before I do, I just want to warn you that I am getting over like some sort of cold or something, so my voice might sound a little bit different, and I'm going to try my best to edit out any of the coughs. But anyway, today's episode was inspired by my experience when I went to go tour a wellness spa that was trying to find someone to rent space from them. So it was when I was still kind of looking for a space to see in-person patients or patients in person. And this wellness spa had some space for me, but they were mostly interested in me because of my background in pelvic floor physical therapy. And that was because I guess the person who was previously renting that space was an OBGYN or something, and was using some sort of machine. I forgot what it was called, but it was basically, from what I could tell, just a really, really fancy e-stim machine for the pelvic floor. But the machine had been super expensive, like I guess $200,000 or something. And so since they didn't have anyone who was trained to use the machine, it was just kind of sitting there. And so besides wanting to, rent that space out, they figured that, if I can use the machine, then it wouldn't be just sitting there. They could still make revenue, make back the revenue from buying the machine or whatever. And the thing that bothered me the most, though, was that instead of focusing on like all the benefits that patients could have with this machine, which, spoiler alert, like in my professional opinion, like I said, this machine was kind of like a fancy e-stim machine. So not necessarily something that could necessarily benefit patients any more than like just a regular standard e-stim thing for the pelvic floor, or just like good pelvic floor physical therapy focusing on like muscle coordination. But anyway, so instead of like focusing on the benefits that this machine could have on patients, they like were really trying to convince me to be able to use this machine, because I had to like pay for some training or something on the machine specifically. They kept emphasizing the fact that because it's not covered by insurance, like I could charge like $12,000 for like a 6-session package or whatever. And as if like that would convince me to use this machine. And it kind of just reminded me of a Instagram post that I saw somebody post of them like using some vibration plate at a physical therapy place, and saying that it was for recovery. And vibration plates do have their place, like they're actually used in evidence-based physical therapy, but for like actual conditions, not just for like muscle recovery, like athletic recovery, like, and so I thought it was ridiculous. Like hopefully this person did not pay a lot of money just for like the quote unquote perk of that service. But like all of these things put together just kind of made me really think. And I'm just, because when I created my business, I did it out of, I don't want to say out of the goodness of my heart, because that just sounds so like cliche, but I did it for a purpose. I did it because I saw like people, like athletic individuals, like athletes in the clinic who weren't getting the care that they needed, either because of insurance or because like the clinic itself wasn't equipped to help them very well. And so I saw that need, and that's why I created my business. And obviously, when you have a business, you need to be able to make money to run the business. But like the main point of the business is to help people that weren't being helped very well, the traditional way. And so like seeing these things like the wellness spa, which in and of itself, like I don't know, honestly, I'm not like a huge fan of wellness spas, or I'm not a huge fan of the ones that say that they have the answers to certain things. If you want to go to relax, that's fine. But like, because this particular one was like one of those IV vitamin spa things. And that other physical therapy place with like advertising the stupid vibration plate, like those types of places I don't agree with. And it just kind of made me think, like, am I that naive? That like I started a business to help people instead of wanting to make money. But yeah, and you know, so many of these types of things exist in like the health and wellness world, that I wanted to talk about some of the most common things that I get questions about as a physical therapist. So today I'm going to talk about dry needling, shockwave therapy, PRP, and low light level therapy, of which red light therapy is part of it. So red light therapy is low level light therapy, but it's just like a specific section of it. And I want to go over what each of these things are and how they work based on the evidence and whether I think they are worth it. Because I think it's important to help people understand, like, you know, if something is actually going to benefit them, but they have to pay out of pocket, like that doesn't necessarily, or having to pay out of pocket doesn't necessarily mean it's a scam. But there are definitely ways that things that actually do benefit people can be sold as a scam, if that makes sense. But yeah, so first I'm going to go over dry needling. So the dry needling, as defined by the American Physical Therapy Association, is a skilled intervention using a thin filiform needle to penetrate the skin that stimulates myofascial trigger points, musculature, and connective tissue for the management of neuromusculoskeletal disorders. So dry needling is not to be confused with acupuncture. I know a lot of times people will compare the two or say like, oh, it's like acupuncture or whatever, because the majority of people have a general idea of what acupuncture is, and then dry needling just sounds weird. But the biggest thing they have in common is that they both use thin filiform needles. There are needles that are specifically made for dry needling, but a lot of people who do dry needling will use acupuncture needles. However, that's kind of where the similarities end. Dry needling and acupuncture both use different clinical frameworks. So their use cases are a little bit different, and the clinical reasoning behind the application of dry needling and acupuncture is also a little bit different. But basically, so I'm going to talk about dry needling. I'm not going to talk about acupuncture. So basically what dry needling does is, or how it works is, it resets the function of the muscle along with triggering your body's natural pain relief system. So this works by the needle insertion itself into the muscle, and any other, there's two different techniques. There's adding electrical stimulation to the needle, and there's also a pistoning technique where the needle stays under the skin, but it's like you pull back and bring the needle back and forth to kind of target different areas of the muscle near the insertion point. I personally, because I am certified in dry needling, I personally prefer to use e-stim than the pistoning technique because I just think e-stim is a little bit more comfortable than pistoning technique, but it just really depends on how the person was trained and also patient preference, because I do know someone who, for some reason, she does not respond very well to e-stim, but she's totally fine with pistoning. So, but the actual, like, the insertion of the needle and whatever technique is used to manipulate the needle is what triggers the biochemical processes in the body that's going to, like, trigger that natural pain relief system, maybe create, like, I think one of the theories is, like, it creates, like, these micro traumas or something, and that's kind of what triggers your body's, like, remodeling system and things like that. But in the evidence, there's definitely an application for pain relief, so it does help with pain relief. In terms of some of the other stuff, like, I don't know if people usually look at dry needling as jump starting, like, a, like, tissue remodeling or tissue healing. I feel like when I've heard people describe that, it's more in the sense that it's going to increase blood flow to the area, and it's that increased blood flow that improves tissue healing. But I feel like dry needling doesn't necessarily have other outlandish claims beyond, like, the pain relief and maybe, like, improving or decreasing, like, the trigger points and stuff, which that in and of itself has its own, like, little history. But for the sake of this podcast, unfortunately, there's not too much research evidence on specifically dry needling, because a lot of the research that people use to back up dry needling is actually research on acupuncture, of which there are many different kinds of acupuncture, from what I've learned. But again, even though they're kind of similar, they are not exactly the same. So it's really hard to make claims on dry needling specifically while trying to use evidence from, like, acupuncture techniques and stuff. I will also say that some dry needling courses will also incorporate some acupuncture like techniques, and I feel like that muddies the water a little bit as well. But in practice, so what I've experienced as a clinician and what I have witnessed from, like, my coworkers and as someone who's gotten dry needling myself or sought out dry needling for certain things, it is something that can have really good results, and is definitely something that's worth trying if other things haven't worked yet. So the way I was taught in my dry needling course and how I view dry needling is, we're going to try some other things first, and there's only going to be very, very few use cases where I'm going to be like, this is the first thing we're going to try before trying other exercise stuff. And one of those is going to be dry needling your upper traps if someone's coming in for neck pain, because I know because neck pain itself, like, that, it's really tricky. It's a really tricky thing to treat because there's so many nerves and things around your neck. But what I know for sure is that people who get dry needling in their upper traps will usually at least have some pain relief, and that's going to allow them to do the exercises that are going to cause the long-term changes to decrease their pain in the long run. So besides that, I typically use dry needling almost as a last resort. I say that was more true when I was working in an insurance-based clinic than I am as a cash pay clinician, mostly because dry needling is a little, or at least I think it was just the way our clinic was set up. It was a little time consuming to set up, and a lot of insurances do not reimburse for dry needling. And so we are essentially like not getting paid for the time that we're doing the dry needling portion of the session. And that's why a lot of times, like even if you're using your insurance to go to physical therapy, if they suggest dry needling, they're going to tell you that, they more than likely will tell you that it's a extra cost, like you have to pay, I don't know, like $50 or whatever, or $25 extra, or some, versus cash pay, like you're paying a flat fee anyway, so they're going to include it as part of your treatment without like a second thought, so to speak. So dry needling definitely has a use case for decreasing pain. In terms of some other claims that people make for dry needling, in terms of like recovery and things like that, that might be a little bit more mixed. I mean, yeah, if the reason why you're wanting dry needling for recovery is to decrease like DOMS or something, pain from DOMS or something, I suppose there could be a use case for that. I know in my training, like some people might want to use dry needling as part of their warm-up or something, but that's also going to depend on the person's reaction to dry needling. Because for some people, it's going to kind of inhibit their muscle contractions. So it's going to, like, I don't know, I call it like dead leg. Because, for example, when I've gotten dry needling, like, it feels like that leg, or like I've gotten dry needling on my glute, for example, and then it feels like that glute is like super, super sore. And like, I definitely wouldn't want to do like an important workout right after that, but I would feel better the next day. So it just really depends but some other people aren't as affected by that. So I think there was at least one study that showed like low level evidence that it can help people kind of, warm up for their event. But I don't know, like if you want to pay out of pocket for that, fine. But I feel like there's other things that you can do besides dry needling that will also benefit you. Okay, and then so next is shockwave therapy. So shockwave therapy is the use of sound waves or acoustic waves to trigger your body's natural healing and pain relief system through a process called mechanotransduction. So this therapy was actually first used by urologists to help break down kidney stones, because the sound waves would kind of break down or fragment, so to speak, the calcium deposits of the kidney stones. And so I think one of the first uses of shockwave therapy in the orthopedic side, in the orthopedic world, was for calcific tendonitis. So that's when your body starts, or that's when the tendon starts getting calcium deposits. And so the calcium deposits itself is what causes the inflammation of the tendonitis in calcific tendonitis. And so, logically, it helps break down kidney stones. And so it also helps to break down those calcium deposits. Once those deposits are like gone, broken down, reabsorbed by your body, whatever, then that relieves the takes away that nothing's irritating the tendon anymore. And so that's kind of how it helps. Since then, people have, I think it's also been like approved, quote unquote. I guess now that I think about it, I'm like, I don't know who's approving this, but I don't know if it's like insurance, whatever. But since then, it's also been used for like plantar fasciitis, other tendonitis, like normal tendinitises. And then some other cases, like I think there's research ongoing for like things like shin splits, or bone stress injuries, and bone regeneration and like varicose veins or something. But right now the evidence is mostly showing really good results for calcific tendonitis, which makes sense, and also plantar fasciitis. But it's kind of mixed for normal tendonitis, like whether it actually helps over like doing other things like normal physical therapy. So definitely calcific tendonitis, you're going to have benefits. Plantar fasciitis, you're going to have benefits using shockwave therapy. But for some of the other stuff like normal tendonitis or just like, I don't know, muscle pain or something, like it's, you know, it's kind of like, like, yeah, it's not going to hurt you necessarily, but you're probably not going to receive much more benefits than if you did something else. So next is PRP injections. So if you don't know what PRP injections are, PRP stands for platelet-rich plasma, and it's a treatment where so they use your own blood. So they take your blood out and then they spin it down to the concentrated like platelets and other substances that's already in your blood, like the growth factors and cytokines that help with healing and things like that. And then they use that mixture or that sample and they inject. That's what they use to inject into the area. So like your knee or your shoulder or whatever. And while initially it was thought that PRP could help with actual tissue healing, because theoretically you have all of these substances in the blood that help with that aid with tissue healing. So if you concentrate them and then like inject them where you want there to be more healing, like theoretically that's how it would work. But after many clinical trials over the last few years, like people or researchers still haven't been able to prove that it actually helps with like healing tissue or regenerating tissue. But what it does help with is pain. So it does help to decrease like that inflammation. It helps to decrease pain in certain areas that weren't responding to anything else. So it is helpful, but not with like it is helpful depending on what your expectations are. Like if you're going for pain relief, like yes, there are studies that show that it helps with pain relief. But if you're going because you think it's going to regenerate your knee or something, there hasn't been any meaningful studies that actually prove that it will regenerate anything. Another thing to note is that apparently there's different preparation parameters that may affect the sample. And so that affects its effectiveness. And so if you go to one particular clinic, they might have different parameters than a different clinic. And so maybe you had really, really good results at this one clinic, but then you moved away and now you found a different clinic. Maybe you might not get as good of a result from that clinic. So I think that's also why there is variability in the cost, because I know a previous client has told me that in Kentucky she's gotten PRP injections before, and I think she only paid like $500 versus here in Vegas I think it's pretty common for people to pay like $2,000, and this isn't something that's usually covered by insurance, if at all. So this is something you're gonna have to pay out of pocket. So that's PRP. And then last is low-level laser therapy, of which red light therapy is a subset of. So low-level laser therapy is going to have like the other wavelengths or whatever, and in red light therapy, it's going to focus on the red light wavelengths. So basically this works through photon absorption, and like part of your mitochondria absorbs the photons from the laser therapy, and then that's what triggers the biochemical response in the cell. And there is so similar to PRP, there is good evidence for pain relief, but poor evidence for actual tissue healing in humans. Because I will say there are quite a few positive studies, or there are quite a few studies that show that it does actually heal tissue, but they're all animal studies. Like if you take the animal studies out and only look at the human studies, it's pretty mixed at best, whether laser therapy actually helps to heal tissue beyond just the pain relief. However, I think I had first heard of light therapy in physical therapy school when we were talking about wound healing. So that's going to be separate. I think there is actual good evidence in human studies for light therapy for wound healing. But if you think about it, like wounds are typically on your skin. So it's like, on the surface of your skin. And so the light is going to be directly affecting those tissues versus a lot of people will try laser therapy for like their knee or like their shoulder or their back or something. And so if you really think about it, like that light, it has to penetrate through the skin and then through your fascia and then the muscle, and depending on how deep you want the light to go, that's where depending on like the actual part of your joint or what have you want the light to affect. The light has to go through all of those layers. And so it's like, it's up in the air whether like just having the light on like your skin is going to cause like those, that is going to trigger those biochemical events that are going to filter down into like the muscle or the joint itself. And so, but in terms of like if you have a wound, light therapy is good for that. But I mean, it's the thing that you want the light to be affecting is literally getting touched by the light. So, and also there in a lot of the studies, like it's hard to compare studies because a lot of them had different parameters like wavelength, dose, and duration. So it looks like it seems like there's not an established, like, I think there might be an established settings or whatever. I can't think of the word right now, but I guess if you go to like an established business that has like affiliates around the country, I know of one that is kind of affiliated with my old clinic, or my old clinic is actually what they call a physician-owned physical therapy clinic, and so the physician's clinic is associated with this laser therapy clinic. I don't want to say the name of it, but like if you go to something like that, obviously there's going to be a little bit more uniformity or consistency. I think that's the word I'm looking for. But in terms of going to different types of clinics, or maybe going to like a clinic like that has a powerful like machine laser thing versus like just buying one like online, I mean, those are going to be very different and you're going to have different results. So, but at the end of the day, good evidence for pain relief. But if you are trying to get this therapy because you want to help with tissue healing, I mean, it's probably not going to help with the actual tissue healing itself. So after talking about all four of these treatments, are they worth it? So like I already kind of alluded to, it really depends on what your expectations are. So a better question to ask is, what is the cost of pain relief to you? Because if you're considering these therapies because you want your, like, let's say you had surgery and you want your recovery to go faster, you want your injury to heal faster, or you want faster tissue healing or whatever, like, you will probably be disappointed. But if you're going because you are trying to improve your pain, you're trying to decrease your pain, and like, hey, if it does help with tissue healing, cool. If it doesn't, you're just, you're like whatever. As long as it decreases your pain, that's fine. Then I feel like these therapies then would probably be worth considering for those. And also, if you can afford it, because that I have had a few people ask me, because like I think that the laser clinic that my old clinic is associated with, or the physician practice it's associated with, I think it's like $250 for 6 sessions, which for some people $250 is like, it's an expense, obviously, but it's just kind of like, well, worth trying because I'm in a lot of pain and I can't do anything right now. But for some people, $250 is a lot. It's like, do I pay for like gas for my car, or do I pay for this laser treatment? And in that case, like, I feel like it's not necessarily as worth it, because yeah, it's going to decrease your pain. But for example, if you had a knee replacement, if you wait like 2 weeks, that pain's probably going to get better anyway. So those are all things to think about when considering whether these treatments are worth it. Some other things to think about are if a healthcare provider suggests these treatments, like, are they suggesting the treatment as part of a well-rounded treatment plan? Or are they saying just get this one treatment, like just get the dry needling or just get the PRP or just get the laser treatment, like, and then you'll be fine, because there's definitely a difference between treating these things as like a miracle cure or miracle treatment, quote unquote, versus as a tool in a part of a well-rounded treatment plan. Because I do understand like how much pain can affect someone, especially in physical therapy. Like if someone, like I try my best to choose exercises and things that are not going to irritate that person even more, irritate their injury or their pain even more. But, sometimes there's just no way around it. It's just that tissue is just way too irritated. So, if one of these treatments can decrease their pain enough so that we can focus on their range of motion and their strengthening, then that's definitely worth it. And so as part of that, with that, some red flags when people are advertising these things are like, if they're advertising it as like, oh, you need this because it's going to heal tissues, or if they're overpromising on results like that versus saying like, hey, I think, you would benefit a lot from this treatment. It's up to you if you want it because you're in a lot of pain right now, but maybe this dry needling will help you decrease your pain enough so we can focus on your exercises. Then, those are two different things. And again, the being sold as a standalone solution, like none of these are necessarily standalone treatments for the long term. For the short term, obviously, like if, for example, I don't want to say I'm guilty of it, but I am guilty of this. Like, I know I need to strengthen my calves, improve their endurance, but before my high rocks race, like my calves are kind of bothering me, and so I did get shockwave treatment because it has helped me in the past before. But that's partially because this was like the week before my high rocks race. Like I'm not going to improve the endurance of my calves in 1 week. And so I got the shockwave therapy just to get me through the race, and then after that, my plan was to incorporate some like calf strengthening and endurance things, so that my running wouldn't affect me as much for other things like triathlon and high rocks in the future. But besides those specific use case scenarios, like these treatments aren't necessarily a standalone solution for long-term results. However, I will acknowledge that these treatments do make people feel better. And with the exception of PRP, because that's like, I feel like that's a little bit more excessive and very expensive. A lot of people will use dry needling, shockwave therapy, and light therapy as part of like a maintenance plan, almost like getting regular massages because it makes them feel better. Or they'll use it kind of like as a maintenance plan, so to speak, so that they don't get to a point where they're like, they feel super beat up. This is more for like professional athletes or people who are like doing high volumes of training. They'll get these therapies so that they can continue training at the level that they are. Because I do acknowledge, like, if you're training at a certain level, like, you try everything else, or actually I want to caveat this. So for people who are doing that amount of training, like professional athletes, a lot of them will also have their sleep dialed in, their nutrition dialed in, and all of those basic things. And then so the extra is the maintenance therapy to help them like feel better, versus if somebody is maybe not a professional athlete, but they're wanting to work out more, or an aspiring professional athlete or something. Like, using these treatments as recovery is not a substitute for dialing in your nutrition or your sleep habits. So that is the caveat. But I do acknowledge that people will use these as kind of like a maintenance plan. And so in that situation, I mean, like, I feel like that's totally fine, as long as the person, again, is able to afford it. Because like I mentioned, these, and especially if you're using it as maintenance, like, insurance is not going to pay for maintenance for, like, if you don't have like a disease or something. So you're going to be paying out of pocket for this. And like, if you're going to use it for maintenance, like, potentially doing this for long term. So if you're okay with paying out of pocket for it, like, and you do you, but understand the limitations, that these are just, like, maybe it'll give you that like 1% edge, but only if you have all the, like, the other basics dialed down, or dialed in. So technically these, like, outside of normal, like, rehab, like outside of injuries or outside of like recovering from something else, like surgery or anything, like, these treatments are not necessary if you're otherwise healthy, but I do acknowledge they do make you feel better. So some people will choose to get them regularly as part of a maintenance plan. But yeah, so at the end of the day, these treatments they're called treatments, but they're really tools. They're not like individual, like, standalone solutions. For someone recovering from an injury, the thing that's going to make the difference long term is going to be loading. So that's the part that you need to focus on in rehab, is loading the tissue and rebuilding its capacity, especially for everyday athletes. And maybe you don't have a range of motion or strength deficit and you're just going for pain relief. You know, like, again, you do you, if you can afford it. If you're fine with repeated treatments, like, that is definitely your choice. But especially if someone's dealing with like an injury for a long time, and because they're dealing with the injury or pain, I mean, and avoiding certain movements, now their strength has gone down and maybe the pain has affected their range of motion. Like, these treatments are not going to be a substitute for rebuilding their strength and range of motion. So yeah. So is it worth it? It might be. It's up to you to decide based on what I went over today. But yeah, that's it for now. If you're listening on Apple Podcasts, I would greatly appreciate a follow and a rating if you enjoy this episode. Thank you for listening, and I'll see you in the next conversation.